Hello, my name is Natasha and today I'm going to be doing a dressing change on a coccyx wound. So just to start, I'm going to make sure that my patient has consented to the dressing change. So I enter the patient's room. Hello, my name is Natasha. So today we're going to be doing a dressing change on your leg. The purpose of the procedure is to promote healing and to prevent infection. So I just wanted to make sure that I have your consent for the dressing change, and then the patient hopefully will consent. And then also I could inquire, does my patient need any pain medications before the dressing change? Make sure your patient has gone to the bathroom. And then also during the dressing change, make sure that your patient is in a comfortable position because the dressing change will take a few minutes. So after inquiring all about that, I am going to make sure I'm wearing the proper protective equipment. So I've got my goggles on today. In practice, I like to wear my gown. And then also I'm going to put on some clean gloves. So to start with the dressing change, I'm going to be doing a clean technique. All right, and also too, outside the room, I would have done my hand hygiene before putting on these gloves. All right, so just taking a look at the wound here, I can see it's very red. The patient, if they had a dressing on already, I could look for any shadowing, any redness, any edema, signs of infection. Okay, so got my gloves on, so now I'm gonna just set up my sterile field, and I'm using a clean technique right now. So I have my dressing tray here. So you've got like a 1-inch border. And I've got my tongs here. So the tongs are sterile. In practice, I like to have like the table beside me and then the dressing right there so I don't have to turn my back. So yeah, and make sure you have your forceps facing down. You can put the forceps down. This part can touch the part that's not sterile, but then this has to stay sterile. So I just put it down right there. Now I'm just kind of straightening out my sterile field. Again, I'm just touching the ends only so I don't break any sterility. And again, I'm going to use my forceps here. So this is clean, so I can take this, put this down. And this is just to enhance like my sterile field. So again, I'm just touching the outsides of it. And then I can put it down next to my sterile field here. I'm gonna grab the garbage bag. The garbage bag's not sterile, so I'm just gonna open it up with my clean gloves. So just for the purpose of this video, I'm just gonna put my garbage bag just right here. But normally in practice, I'd like to have it like right beside me. Or actually, yeah, I'm just gonna here's my garbage bag. I'm just gonna put it down right beside me so I can put it there. Okay, so again, just kind of arranging everything in my sterile kit. I've got my gauze here. I'm gonna grab my 2 forceps. Putting those there for use. Again, clean technique. So this is my normal saline I'm using. Sometimes in practice they have like the pink tube, so I'm just gonna pour this into my sterile field. Got my normal saline. So now I'm gonna put everything in my sterile field. So this would be unopened, but we'll just pretend that this is opening a new package, and this is sterile, so I'm just dropping it into my sterile field. I've got my irrigation tip, again, just placing that in my sterile field. Pretty much right now, I'm just doing everything that is a clean technique. and putting it all in my sterile field. So I want to do this before I put on my sterile gloves. Got my packing here. I've got my gauze. Again. Good. And again, normally this would come in a packaging, but I'm just going to pretend that this is in a package and that it's sterile. So I'm going to open up the package and again, drop the dressing into the sterile field. So in this scenario, I'm assuming that it is a new wound, so I'm going to measure it right now. In practice though, I would take the dressing off, you know, have a look at it, and again, since the dressing is dirty, this is a clean technique, but I'm not going to touch the wound. So I'm just going to measure my thing's length and width. I'm using my measuring thing here. So I'd say it's about 7, and this is centimeters. So lengthwise, or let's see, 7 by 8.5. So yeah, 7 by 8.5. So yeah, just measuring it before, again, using clean technique. All right, so now I'm just making sure I've done everything that's a clean technique, and then I'm gonna don my sterile gloves. So yeah, I've got my normal saline in there, dressings in there, gauze, irrigation tip. All right, so now I'm gonna proceed to take off my gloves. And again, my garbage bag is right here, so garbage. And then I've got some hand sanitizer, so sanitize my hands. So now I'm doing my sterile techniques, and I'm going to don my sterile gloves. My sterile gloves come here. So when I put on the sterile gloves, first, I'm only going to touch the inside of the glove, because we have to keep them sterile. So again, only touching the inside of this glove when I'm putting it on. I don't have to pull it all the way. Now I'm just grabbing the glove for my left hand here. So I've kind of put it in, but now I can use the sterile outside to put it on this right glove. Yeah, so now I'm only touching the outside, so it's sterile on sterile, and the inside stitch my hand, and now I can kind of put it on. All right, so now I'm doing a sterile technique. So gloves are sterile, so now I'm actually able to touch what's in my sterile field. So the first thing I'm gonna do is just look at my wound and assess it. So you can kind of see here in the video, my wound bed is very like pink and red. It looks like there's some purulent exudate, so that's a little bit of infection, cloudiness, sometimes a yellowish color. The dressing here, the wound here is a stage 3, and it's a full thickness pressure ulcer. So we're assuming this one was on the coccyx, which is a bony prominence, and that's common for pressure ulcers, unfortunately. And this one also, the staging is stage 3, because when we look at it, there's no fascia showing. So fascia is just like bone, tendon, muscle. So there's no fascia showing. However, there is like a lot of tissue loss, like this is a deep wound. Also, you can measure the depth of the wound as well, but that you can use a, like, I drop a sterile, like Q-tip into my field, and I can measure the depth and then also look for any undermining. Yeah, and then also too, Again, just assessing my wound bed before I start here. The edges are intact. Again, I could assess for undermining with my sterile Q-tip. Okay, so the first thing I'm going to do now, again, I've got sterile gloves on, so now I can touch what's in my sterile field. So, got my Q-tips here. So now I'm just cleansing. It's good to like roll it up into a little ball too, because you don't want to like poke the patient with the forceps. And to keep sterility, you want to touch it, keep the forceps down. So I'm going to want to clean from the least contaminated to the most contaminated. So I'm going to start at the center of my wound and circle around. And then when I look up here, you can see there's like, it looks like there's some serosanguinous, some reddish color, clear fluid, and then also some purulent exudate. And I'm just going to drop that into my garbage. Yeah, I'm just making a little ball. Cleansing from the center around. And dropping it into my sterile field. Center, circling around, least contaminated to most. Drop. Put that down. Okay, so now that I've cleansed that, again, if I had a sterile Q-tip, I could check my wound for undermining. I just put it under the wound and push around to see if there's any like tunneling. Now I'm also going to irrigate my wound. So again, I got sterile gloves here. I got my irrigation tip. This is normal saline, pre-filled syringe. Also, sometimes they use like these small little pink packages and just squirt it on. So yeah, when I do this, don't touch the plunger, keep sterile technique. I want to actually use some force because we're like getting it out. All right, so once I've irrigated it, I want to pack it. I've got my packing strip here. You could also cut it prior to doing this to make it a bit easier. Yeah, actually, since I didn't cut it, you can also use the gauze in the kit. So for this case, I'm going to use my sterile gauze here. And the packing helps with healing. Again, we'll just pack the sterile gauze into there. Yeah, this packing helps with healing. So as I'm doing this, I'm just talking to my patient throughout, making sure their pain's managed. Like I said earlier, I could have given them an analgesia for this. So now that that's there, I'm going to put on my gauze. We'll do a thing over. Also, for this case, there would be wound care orders. So I'd read the wound care orders prior to doing this procedure. Again, I got my Mefex, but like I mentioned earlier, I'm just assuming that this is sterile. Usually I'd open it into the sterile, but for this video, this is sterile. That's why it's within my sterile field. Also too, this is labeled, so we write today's date, write the time as well. Again, I'm just putting this in the center over top of the wound. You can ask how the patient tolerated it. Again, it's dated. So yeah, that is the dressing change there. I'm going to take off my sterile gloves now. perform some hand hygiene. I'd clean up the whole sterile field here. And then also I would leave the room and then I'd go document the whole procedure. As I mentioned earlier, I'd want to document like the wound bed. Again, as I mentioned earlier, it was like pink and red. I could mention how there was like serosanguinous fluid, also some purulent exudate. Again, as I mentioned earlier, is a stage 3 pressure ulcer. So I would write that as well. Also too, when I'm doing the whole procedure, I can note if there's any odor at all. As I mentioned, I just didn't have a Q-tip, but in practice I'd bring a sterile Q-tip and then I could check for any undermining. Yeah, and make sure you document everything, look at the wound edges. The dressing is dry and intact now. So yeah, that is everything. I hope you enjoyed watching this wound care video. Thank you.